Welcome, everybody. We are so excited to have all of you here today. My name's Natasha. I'm from Community Action Network, and I'm wishing you all a very warm welcome. And even though I'm offering you a warm welcome, I do hope that you're all cool and you're somewhere comfortable. And just a reminder that we are recording, so if you do need to pop off and get a drink or go somewhere cooler in your house or your office, please do. And just while we do the main presentation, if you could just check that you are muted, that would be helpful as we're quite a large number of people here today. Thank you. So, as you may have seen, we're here because the NHS has very generously given us a pot of £1 million to distribute to these wonderful voluntary sector groups in Dorset. In fact, this is the second 1 million pot that they have provided. So today is going to be explaining to you what the pot is for, the criteria, any information that you might need to decide if this is the right fund for you to apply for. So we're going to give you some tips about applications, and we're also going to be talking about the work that you will be doing with Access Wellbeing, and also the application support that we will give you at Community Action Network. So we, along with Dorset Community Foundation and Ellie Maguire, who you'll be hearing from shortly, and also Access Wellbeing and Becky Hacking, who's here, and NHS Dorset, we have come together to fund these grassroots community groups, and so that we can help get some of these mental health projects and wellbeing projects that alleviate pressure on clinical services going and funded. So hopefully you're at the right meeting. Okay, so there's going to be plenty of time for questions at the end of the event. You're going to have time with all three of the organisations and also some general questions. So if you do have any questions as we go, please write them down just while we do the main presentation piece, which isn't too long. And as Tam has put in the chat, please just introduce yourself, let us know who you are, who you're representing, and we'll get going. Thank you. So Becky's going to be speaking first, so bear with us while we just get our presentation ready.
Sorry, I was just moving rooms. My internet connection was starting to fail, and I thought that is not the right time to fail when I'm just about to speak to everybody.
Absolutely not. Absolutely not. Okay, so we're just getting those slides up. Very good. Welcome, Ade. Welcome, everybody. Really good to have you all here. Okay, Becky, when you're ready.
I can't see anything on my screen yet. Am I the only one, or?
Can you have thumbs up from anybody? Can everybody see the slides?
No.
Yeah, I can see them.
Me too.
Great,
I can see them.
Thank you. Thank you, everybody. So if anybody can't see them, just message in the chat. Maybe we can give you a bit of support so you can see them.
Okay, I can see them.
Great.
Okay, welcome everybody. I'm Becky Hacking and I work for Help and Care, which you can see my logo in the top of the screen there. But I am the Service Development Manager for Access Wellbeing that works across Poole and Purbeck. But we're a partnership made up of different voluntary sector organisations. So we've got the Lantern Trust, BCHA, and Mind and Harmony that work alongside us to deliver Access Wellbeing Universal. So what is Access Wellbeing Universal? You can see the banner there talks about Access Wellbeing. That is the wide umbrella of support that is Access Wellbeing Universal, which is our services that we deliver right up into secondary services and secondary care where you'd receive specialist support. So Access Wellbeing is all about getting the right support at the right time in the right way so that nobody is walking into any one of those mental health services or services that are designed or not designed to support people's mental health challenges, but that they can access navigate to the right support to have that conversation. So by bringing together community organisations, healthcare and local partners, we're making it easier for people to have those conversations. And then that's part of the ambition from the mental health transformation that took place in Dorset for a couple of years before the concept was designed, and then the hubs began to open in Poole and Weymouth, and then followed by Boscombe and various pop-up locations, which we'll obviously point you in the direction of towards the end of this presentation. There's a map that outlines which organisations work over different parts of Dorset for your reference as well. Thank you. So this kind of demonstrates the sphere of support. So like I've talked about, we work in the universal services, so people will come in and have a conversation around what they're struggling with, what support they need. They might have just lost a job, they might just be feeling low from a relationship breakdown. It could be any number of issues that you'll all be well aware of, the issues that people face, and we're there to help navigate them to local support, so building on all of the connections and assets that we've got within the communities we work to help people feel supported. We've also got access through to focus support and specialist support, which we'll be able to talk in more detail at a later date. But that means that we can escalate people to have the right conversation that they need. So that could be secondary care support. It could be steps to wellbeing support that will come in between. It could be any number of layers of support. But the important bit is that people get to have the support that they need when they need it. So here's some examples of where we have connected and we have better outcomes. So that's about bringing the system together. So I've talked about all those different layers of support, but by working together as a system and connecting in that way, we can support people better because we're looking at their bigger picture and holistically resolving their issues alongside one another, and kind of reducing those barriers where we would usually have issues of people being restricted by the boundaries within their organisation or barriers to be able to support somebody. The idea is that we work together to make sure that everybody has those bits of support that are important for them to move on to what is important to them, is going to make them better in the long run. Okay, and this is the map I was referencing. So you can see the three main hubs there. One's in Weymouth, one's in Poole, one's in Boscombe. And then all those little pinpoints there you can see are all our drop-in sites. So they're all across Dorset. You can see it on our interactive map on our website now in terms of where they're based, when they're open, what days and what times. And like I've said, anybody can drop into those spaces at any time and have a conversation with somebody. So there isn't a waiting list. People will come in and can have a one-off conversation and be signposted somewhere else, or they can come in and have a series of conversations with a wellbeing coordinator that will then work with them over a number of sessions to think about how they're going to support themselves, what that looks like now and what that looks like in the future, what their support network looks like, and what other services are needed to fulfill that need and those issues that they're facing. There you go, there's an overlay map of which partnership works within which area, to the organisations from the partnership, apologies, and which areas they cover. So again, you can ask any questions to any one of us, and I'll do my best to answer any questions towards the end of this. But like I've said, I work for Help and Care, and we cover the Poole and Purbeck patch, but I'll do my best to answer any questions. But if I can't answer them, I can certainly introduce you to the people that can.
Amazing, thank you. That was a really good summary in a very short period of time. So really helpful to hear, you know, where these groups can go to access your support. And we'll talk more at the end about how you then make contact. Brilliant. So we're going to pass over to Ellie. Ellie, I can't see you.
I am here. Here I am.
Lovely. That's wonderful. So Ellie, I'll just pass over to you to introduce yourself and yeah, take it from here, please.
Thank you. Can you just remind me when I need to finish by? I should have looked at the agenda.
You have 15 minutes. You have slightly longer. You're our star.
Excellent. I think it's important just to give a brief bit of background. So this fund launched in 2024 after the Wellbeing hubs through Access Wellbeing had started to set up. So if you're not aware, NHS Dorset put aside a few £1 million to invest in mental health services locally and to try and shift how mental health was delivered locally away from clinical NHS services. They wanted to support community-based services. So Access Wellbeing was the first thing that they supported, and that's been developing ever since, and these different pop-ups have been coming up. The second bit of investment they made was into this funding programme. The idea being that the wellbeing coordinators, once they've been working with an individual for a period of time, they want to be able to make a really warm handover into a really friendly and helpful community service that can help continue that journey so that they can keep getting better, they can make more connections, more friendships, more of a, a wider community setting that is offered after that one-to-one contact. So the idea from the NHS Dorset's point of view is that they funded the Access Wellbeing, and they also wanted to fund the services into which wellbeing coordinators are referring, so that there's a breadth of what is available. So that's why you'll see in the fund that there is an expectation that you have either already developed a relationship with your local Access Wellbeing hub, or that there are plans in place to do so. And I think that is something the panel will be looking for. So if you haven't yet had a conversation or an introduction to your local Access Wellbeing, now is the time to do that before you put in your application. Just start a conversation, see what signposting might look like, or how you might work together. Some of the wellbeing coordinators have been able to visit some of the groups, which has been really helpful, because then they've got a real lived experience of what it's like in your service, just to help with that warm handover. So that's the background to the fund and why there is this key relationship between your service and the Access Wellbeing service. And it's important to say as well, it's about two-way signposting. So it's not just making sure Access Wellbeing know what you do. It's important that you understand what they can offer, because if somebody can benefit from multiple services that offer different things, obviously that's so much the better, isn't it? So that's just a bit of background, really. This slide is just giving you a bit of information about what we funded back in 2024, and hopefully lots of you will be delivering similar work. So it's all about community-based services, not clinical services. So we funded everything from sea swimming to arts and crafts to gardening and nature walks. And you can see there the different types of issues that were being addressed by these projects we funded last time, from depression through to loneliness, disability, looking at the impact of poverty, etc. And a lot of the real common benefits were around these kind of constant messages about, I felt safe in this place. I got to meet with other people who had similar challenges, which was really inspiring. I learned new coping strategies, things that had worked for them. And actually, it made me want to get out of the house for the first time, sometimes in a long time. And I discovered an activity that I find therapeutic, something that I can continue doing at home with other people and at these sessions. And a really strong kind of through story was around actually, even when the participation in that service ended, I had a new friendship group, and we were starting to meet outside the group, and actually there was an evidence of that ongoing resilience as a result of taking part in the community activity. There was actually a lasting benefit through their new friendships or their new hobbies and their new coping strategies. If I move the slide on, does that work for everybody? Yeah, perfect. So yes, so we've got another £1 million to spend again in 2026, which is fantastic. Just to be absolutely transparent, we had some feedback from the groups that we funded last time, and there was a strong message around multi-year funding and a strong message about the need for continuation funding, and the frustrations with constantly having to seek kind of this hand-of-mouth grant funding, which I know you're all aware of. So a selection of the groups that were funded last time have already been invited to apply for continuation funding to continue what they're already doing. And that process has already started. And then this process is the open call process for anybody who wants to apply, can apply. And we've gone for grants of up to £20,000 that can be spent from 18 to 24 months. So we anticipate many of you will use the grant to support your services over a 2-year period. But if it's slightly less than that, that's okay as well. But those 2-year grants are available only to groups who are a bit more established and ready to receive a 2-year grant. So we're saying that you should have been delivering your activities for at least 2 years, and that you need support to continue those same activities. You don't have to ask for 20,000. If you're a real small grassroots group and you'd like to ask for, I don't know, £8,000 each year for 2 years, that's fine as well. And do bear in mind, you don't have to ask for the same amount in each year. So you don't have to ask for 10k and 10k. If actually you anticipate your service will develop over that 2 years, and so demand will be higher in year 2, you could ask for less in year 1, more in year 2. Equally, if you need perhaps a bit of equipment, you've got some startup costs in year 2. For you, it might be that your year 2 costs are higher than your year 1 costs are higher than year 2. So just bear that in mind. It's up to you to manage that budget how is best for you. So if you're a newer group and you've been delivering activities in the community for less than 2 years, you can still apply, but it would be for a 1-year grant of up to £5,000. Again, if your grant period is slightly less than a year, that's okay as well. We will try to be flexible. And those 1-year grants are also designed for any established groups that want to try something new for the first time. So we're hoping the 2-year grants will largely be for continuation of stuff that is already evidenced, is already out there and doing well. But if you've got a new idea for something brand new, then please apply for the 1-year grant, which is a good way to pilot that idea, test it out over a year period with a view, obviously, hopefully you can take that idea to another funder if it works. Deadlines on there, midday, 6th of August. And the outcomes you should be notified in sort of early October. So the earliest start date I would suggest is somewhere mid-October. So it is an adult only fund. So we're talking about services that are working with adults aged 18 plus, please. This is very much around the prevention and early intervention into wellbeing and mental health needs. So it's about capturing people who are already on a downward trajectory in their mental health, but actually at such a point where they don't need a specialist NHS related service, actually they're better receiving a service in their community because we're capturing them at an early point in their struggles. And that's the idea of the fund. Again, from an NHS perspective, they want to see burden on NHS services relieved. So they want to see less people going to their GP, going to A&E with a mental health wellbeing related issue. So they're hoping if we can capture these people within community settings at an early stage, they're less likely to keep declining and end up in an NHS appointment. That is really the bare bones of what the fund is about. So it's community-based, it's non-clinical, so be really careful if you're a counselling organisation, for example. We would consider a counsellor, professional counselling service as a clinical service because it's something that is provided within the NHS. So just make sure you check in with me if you're not sure if you will be classified as a clinical service, but essentially clinical means it's already offered within an NHS setting. They're wanting to support something different, something that's community-based, activity-led, with other people. So we're not, again, it's about early intervention and prevention. So it's not really intended for somebody in severe mental illness, although we can support projects that work with individuals that have perhaps had some treatment for a mental health condition and actually need support with their continuing recovery to prevent a relapse. So that would still classify as early intervention because you're making sure at an early stage that they don't fall down again. So we can work with people who are in recovery or have had services, but it's not designed for somebody who at the moment is in crisis. I think that's all I need to say on that slide. We've talked about the Access Wellbeing link, that's important. So eligibility, I think I won't go through the slide in too much detail because we're so lucky to have CAN working with us for this fund. So they will be doing all the pre-application support for you. So if you're not sure if you're eligible, you know, that's where CAN will be able to come in. But the bare bones is that you need to be a not-for-profit organisation, so we can support charities and CICs, as you can imagine. We can support groups that aren't registered with a body. So if you're what we would call a constituted community group, the minimum requirements is that you have a constitution or a governing document, that you have a minimum of 3 people running your organisation, and that should be 3 unrelated people, and that you have a bank account in the name of your organisation that the grant can be paid to. And bank accounts should have at least 2 people required when you make payments, so a kind of dual signatory safeguard. That's something pretty much any funder you apply to is going to need. So if you don't have that dual signatory on your bank account, make sure you check in with CAN, see which banks are offering that facility, and that you've got that in place. A quick word on national charities. We don't support national charities at DCF, generally speaking. So if you're delivering services, by national charity, we don't mean you're delivering in every county of the UK. That's quite unusual. But certainly if you're delivering in areas above the south, so if you're delivering, you know, Manchester, Liverpool in the Midlands, for example, then unfortunately you wouldn't be able to apply. If you're regional, so perhaps you're working in Dorset in Hampshire, or you're working across the southwest, then you could still apply. We do sometimes support regional organisations, although you would be a lower priority, but we do sometimes fund regional, so that's okay. If you're a faith-based organisation, it's important that I just tell you that we can't fund any activities that involve any influence on somebody's religious choices. So we couldn't fund anything that involved prayer or scripture or conversations about faith. We can absolutely support activities you're running that are purely for the community and are very separated from your religious activity, but that needs to be really clear. Ideally, in your constitution, you need to have charitable objectives in there that are for the community and not related to promotion of religion, and then we'd be looking to see how you separate those activities to make that really clear. We can't fund schools, unfortunately. Again, that's across all DCF programmes. PTA groups are often eligible. Many of them are charities or constituted groups, so that's okay. And then there's a few other exclusions there, which hopefully are kind of self-explanatory. Supporting documents, so like most funding programmes, we do ask for these set of supporting documents. Again, I'm not going to talk to them because if you're not sure that you have one of these policies or anything else on this list, CAN is there to support you, and they'll make sure that you're kind of ready for funding and you've got all these supporting documents in place. If you're a very new group and you've been delivering for less than a year, you won't have annual accounts yet, so don't worry if you're a very new group. Although I would recommend, if you've done any kind of financial forecast or planning as to how you're hoping to raise income in your first year and how you're hoping to spend your income in your first year, if you've done any planning like that, that's really helpful to see in lieu of annual accounts, if that's something you've done. Don't create something especially, but it's really helpful if you have got something. So these are the fund priorities, which obviously are on the fund page. And these are the 3 bullet points you need to read, and then read again, because this is what the panel will be looking for. Does your application meet these priorities? So again, the wording is around this early intervention approach in community-based settings, helping people live well for longer and reducing the likelihood of needing an NHS appointment in the future. And around that first bullet point, what I would just expand upon is, in order for the panel to feel really confident that you're reducing the likelihood of somebody needing an NHS appointment, it's really important that services are targeted. If you're offering a service that is helpful to anybody can come along and do park yoga, come along and do an arts and crafts club. This is an enjoyable activity that supports well-being. That's valuable, but I would say it's not a close fit with this fund. Whereas if you're able to say, we are able to identify people who are already struggling in their mental health, they've got early signs of depression or other issues, and actually these are the people that we're targeting, these are the people we're working with specifically, that's a much stronger argument. Because if you can show that they're already struggling, already on a downward trajectory, it's much more reasonable to say, I think they might end up needing the NHS if we can't find a way to help this person feel better and feel more resilient and to live better. So targeted projects are really important to help the panel feel that you're really supporting people that otherwise would need a different type of help. So the second bullet point is all about resilience, so helping people find new support strategies, find different solutions to the challenges that they have so that they can live independently well. And that talk about resilience and how do I make sure that somebody is more likely to cope in the future, even after they've ended their participation with you. That could be around opportunities for them to actually volunteer with you or to give back to their community in some way. It could be around just building friendships with the other people in the group that they're participating with. It could be around giving them new tools that they understand that they can use that in the future. So if I feel unwell in the future, I can try this different strategy. So it's around keeping an eye on what we don't want is to fund really enjoyable activities that people have a great time in and they feel better, and then the activity ends and they're back to feeling lonely, isolated, depressed, etc. I'm sure none of you would ever do that, but it's easier to give an extreme example. Again, what the panel will be looking for is when participation in this activity finishes, will these individuals be more resilient? Will they be more able to cope either by themselves or because of their new networks and friendships? Will they be in a better place, a more resilient place with their mental health? Again, avoiding that the possibility of them being unwell in the future as much as anybody can. And then the third one is all about supporting people in their recovery and managing mental health conditions or wellbeing challenges. And this again goes back to that we have room in the fund to support people who have had a mental health issue and are trying to make sure that they don't relapse, make sure that they can maintain good wellbeing and mental health sort of moving forward. So we talk about self-care and again reducing reliance on NHS services because they've got a different way to manage their health condition and to stay well. We do say there's a priority for groups working with communities who experience health inequalities. There's a link on the fund page to help you understand that term if you're not sure. But health inequalities essentially is talking about groups of people in our society that are more likely to have negative health outcomes. So people for the sake of this fund, we're talking about people who are more likely to experience mental health challenges. So that might be anything from asylum seekers to prison leavers to people experiencing poverty. There's lots of different groups in our community that are more likely to struggle with mental health. So if you're working with one of those cohorts, that will be of particular interest. It doesn't mean you have to hit one of those targets. Don't try and change who you are for a funder. Never do that. If your remit is larger than that, and perhaps you're a village hall organisation that puts on really nice arts for wellbeing activities, you might be there for anybody in your village who is struggling. That's absolutely fine as well. So don't try and change your colours with the fund. But it's just a note to say that. Lots of you probably are working with individuals more holistically, so you're not just looking at their wellbeing and mental health. You might be supporting them around poverty issues, around physical health issues, around other things that impact wellbeing. That's really good. that's a positive thing, because actually if their financial struggles are a key part of why their well-being has diminished, obviously we need to be looking at how do we support them with those financial issues at the same time as lifting their well-being. But it's important that the remit of your activity is kind of mental health first. It's a really tricky fund because it's already in very, very high demand. So we're just trying to be really clear that we're looking at projects that focus on mental health. If your specialism is something different and it happens to help with mental health, it won't be as strong a fit. So try to make sure that you're presenting something that's got well-being and mental health at its heart, even if you have other holistic services that you signpost into. Working in partnership obviously is always a positive. So if you do work in partnership with other organisations or any organisations that you signpost into, so perhaps if someone has got financial problems, you've got an active relationship with Citizens Advice, for example, please tell us about that. It will only strengthen the application to show that you're helping somebody more holistically through signposting and warm handovers. That's also a real positive. In terms of what you can apply for with costs, you can pretty much apply for any type of cost as long as it's clear that it relates to what you're describing, the activities that you're describing. So yes, you can ask for small capital costs, staff costs, volunteer costs, venue hire costs, pretty much anything, as long as it's clear that you need that cost to deliver what you're describing. And please be careful about that, just from a bid writing tip point of view. When you've done your budget, just sanity check yourself. Does everything you've put in your budget, is everything described somewhere in the application? It's quite common that I read an application that looks absolutely fantastic, and then you get to the budget section and 50% of the budget is on a laptop. And nowhere in the application does it tell the panel why that laptop is needed, why it's key for the service, and why it needs an expensive one. So anything you put in your budget, just check yourself. Have I explained, is that included in my description of the service and why I need those items? These are my kind of top tips, and this is for any application really, not just this particular fund. When we talk about why is your service needed, most funding bids you write will ask a question around, is this activity needed? I would say as a local funder especially, we do often get kind of national statistics quoted at us, 1 in every 3 people, etc. And there's often value to that. But our panels are really, really well informed. They're community people. They often know those stats anyway. It's not really adding to our description of why the service is needed. What is more powerful is your knowledge and your data and your experience. So if you can tell us, actually, in our town, this is why this particular issue is particularly difficult for people, or there's a gap in a service in our particular town, or last year our waiting list was this length, or we had demand for supporting 100 people and we could only support 50 of them. That type of information about your experience locally, the panel probably won't know that information, and actually that adds more strength than a national statistics, which would be the same for anybody in any place. We are a place-based funder, so don't undermine the interest of your data. Even if you're only working with small numbers of people, it's still relevant. Don't waffle there, I've put. So again, there's always a question, what are you going to deliver? What is your project or your activity? I always say get someone to proofread it, especially that section. I used to be a bid writer myself, and it's amazing how many applications we receive that have beautiful language about the different things that you're hoping to do and how people will come together and how you're going to collaborate and all these lovely things. And you come to the end of the paragraph and you think, I still don't know what this group is delivering. How many times a week are they going to meet? How long are the sessions going to be? Who's going to be delivering those sessions? Are they offering food at the sessions? Are they not offering food at the sessions? It's just amazing how it's easy to miss out the real basic key information as what does coming to one of your sessions look like? What will happen to those people when they come to the sessions? What are you offering? So just make sure that you're not waffling with lots of lovely language and you're just telling us the bare bones of what you're going to do as well. That's a real key one. For this particular fund, but also for others, it is important you explain how you're going to reach the people that you're going to be supporting. So again, I often see applications where there's real fantastic motivation to run a service, often through lived experience. This was my experience. I want to help other people, and we want to do this, and we want to do this, and we want to help them in these ways. But often what is missed is, but how are you going to get to them? Because with all the the ambition in the world, if you can't actually engage with the people who need that support, you won't be able to run a service. So panels need to feel really confident, yes, that you've got the right idea for a really meaningful piece of work, but also that you can deliver it. You've got a way of reaching those people. It doesn't need to be through very formal signposting or referral routes. It may be for you, you may have a relationship with your local GP surgery or with another voluntary sector group. Fantastic. Name them. Don't just say, we get referrals from other voluntary sector groups. We're a local funder. We know the patch. We know who you'll be talking about. So name them. It always seems stronger and less waffly. But it doesn't have to be a formal referral route. You may have a really good way of reaching people through an online strategy, through promotion through your local library, lots of different ways of doing it. And if you're already doing it, that will also help. But you do need to give us an explanation as to why these people are going to come to you and going to receive your service. Showing appropriate expertise, again, that's going to look different for every group. But it is something that sometimes I feel is missed out of funding bids. And there's not always a question specific to this. There is in this particular application form. But even if you're writing a bid for anything else and the question isn't there, it's still really important. So for an organisation that's offering general kind of wellbeing, hubs, chats, cup of coffee, relationship-based, sharing lived experience, it may be actually that the best person to facilitate that is somebody with lived experience, a trained volunteer, fantastic. If you're talking about people with more complex issues or from a particular part of the community that have more particular needs, it may be that you do need paid expertise to deliver that project. But it's important that the panel understands who is delivering those sessions and why are they the right people to deliver those sessions. Again, it's about confidence that it's well thought through, that the people coming to your service will be safe and will be looked after by an appropriate person. So don't forget to tell us who is delivering the sessions. Outcomes and measurement methods. I think I'll pass this back to Can. Again, you all know, I think, that it's important that during any grant you receive, you are trying to capture the outcomes of what you're doing so that you can evidence that people's lives are improving as a result. So it's not about capturing, 50 people attend every month. It's about how did their lives change as a result of that? What differences are they experiencing in their lives? What positive outcomes? There's lots of different ways to measure outcomes, and it will depend on who your beneficiaries are, what size organisation you are, what capacity you have. But it is important that you find some kind of measurement tool and that you can explain what that's going to be. And in some ways, especially for this fund, because we're hoping to talk to the ICB, which stand above NHS Dorset, about a long-term investment in the voluntary sector. That's what I want to see as a result of this fund. So we have to evidence that it works. We have to evidence that people's lives improve, that people's well-being and mental health improve. And so the panel will be looking for groups that have some way to measure that. So do talk to Can if you're not sure. about that language or about what that means. And then the final bullet point, yes, you will be essentially needing to kind of explain how your work is going to support prevention and reduce pressure on the NHS. You can't evidence that per se. You know, with prevention, you will never know if that individual would have ended up in an NHS appointment without your support. It's really, really hard, but it's just about making a case for that. And again, I think it will come back to how well targeted the project is, where people were when they first come into the service, and how you're able to support their resilience. And hopefully you can make a case that it's likely that by doing this work, we are reducing burden on the NHS. There'll be lots and lots of things I forgot to tell you, because there always is. So please do stay on for the Q&A if you've got a burning question, because it's probably relevant to other people in the room as well. And I'm sure you will pick up on all the things I've forgotten to say in a short space of time. But yeah, hopefully that's given you the bare bones of what the panel will be looking for.
Wonderful. Thank you, Ellie. There was so much helpful information in there and so much gold. And, you know, I think that real personal story of how somebody is helped, and also how their community is helped. So, you know, maybe their family or the wider community around them is something we sometimes forget. And that's so important. I did wonder whether it was worth touching on AI applications. I've heard from some funders that we're getting more and more AI applications that look very similar. I just wondered if you had any view on that.
Yeah, it's sort of creeping along. I wouldn't say I've had loads actually, unless I'm just very bad at spotting them. I don't know. We're actually just writing our AI policy as we speak. I think our view at the moment is that if you want to use AI as a tool to help you with your bid writing, we should not be judging you for that. You know, if it's a tool that will help you, absolutely, that's your choice. But it is a tool, it's not the be all and end all. So I think if you're using AI, you know, the sweet spot is in then reading that properly and making the adjustments you need to make to make sure it is actually reflecting your service properly. So yes, use AI, but I think you've just got to read it carefully before you send it off to your funder, and make sure that it does actually reflect what you're doing properly. That's what I would say. Incidentally, we're not currently using AI for any of our due diligence checks or for decision making. We may in the future use AI tools to support some of our due diligence checks, but we would always double check the information, and we will never be using AI for decision making. Decision making will remain in the hands of human beings, and we always have people with lived experience on our panels, as well as professional expertise as well. So just in case anybody was wondering about how we use AI.
Amazing, thank you. So we'll just move on to the final part of this presentation, just to talk about CAN and the support that we can give you. So we're, for those of you who don't know us, we are Community Action Network. We are a local infrastructure organisation, and we're the primary support for organisational development for voluntary community sector organisations across the county. And we operate under 4 functions of infrastructure, so leadership and advocacy, partnerships, collaboration, capacity building, which is what you will be, you know, introduced to during our work together, and volunteering. And so, you know, these are the NAVCA pointers, and we've been accredited under that as delivering that service to you. So it's a high quality support service based on an asset-based community development framework. So rather than do something for someone, we're here to upskill you and to also use community assets that maybe might have been not been used, or, you know, coming up with new solutions that are community led. So the support that we're offering you is in 2 parts. So we're offering enhanced support compared to our normal service. So pre-application, to make sure that you are funding ready. We will be running some online meetings next week and the week after, because we're aware it's quite a short deadline. and we will offer guidance and support. Some of those will be one-to-one, some of those will be group-based, but we're going to be looking at things like whether you've got the correct legal structure and good governance. We'll be looking at annual accounts, bank accounts, good financial procedures and controls. So some of the things Ellie's already touched on. Do you have two signatories? What policies that you've got in place to make sure that all of the main ones are included, a clear idea of what your project is about and that you feel able to communicate that. That might be something that we can help you with. And then the evidence that the project or service is needed, who your beneficiaries are, what their needs are, and also looking at, what we've just touched on, really, that monitoring and evaluating so that you can show the outcomes and the difference that your project and your great work is making to the people who are participating. So that's what we'll be doing. And at the end, I'm going to just put up a code so that you can access that. And then post-application, we have a role as well. So the groups that are successful, we will work with you on your implementation plans and to make sure that they're realistic, they're robust, that you've got everything that you need. We're here to just help you do the best job possible. And so at the heart of doing that, we will have some masterclasses, some training, some peer support where we bring people together in place-based events. And we really just want to kind of provide that extra capacity, that extra resource to your organisation. And we will do that in a number of ways. So what we like to do is kind of assess where our groups are with an organisational health check, because sometimes we have blind spots in our own organisations. We think we're doing really well in all areas. There might be something that's fallen off the list or could be a bit stronger. So we'll offer a health check. We'll have a look and see where you are. We'll look at those key areas: governance, finance, policies, delivery, monitoring and evaluation, and we'll help you put a plan together for any gaps or any areas that could be strengthened. And then we'll take you through, key areas of support. So for those of you that are new to CAN, this is the practical support and capacity building that we take our organisations through so that they strengthen, all areas of their business. So, areas from business plan, managing risk, managing volunteers, ensuring sustainability and effective running. So you can see the areas. I'm not going to go through them now. We're going to save that for, when we have that deeper level work, but you'll get a copy of this as well. But the benefit of doing this is that, we can really see that, our groups that go through this process, we can see the distance that they travel and how well it strengthens their organisation. So we always put a radar chart together to show our group's progress. And when we look at that distance travelled and we get the feedback, you can really see the difference that it makes at a time when our volunteers and the people running these organisations, you're all at full capacity. So CAN's role really is to kind of step in and support you with that capacity. So we will do that in a number of ways. Like I say, there'll be peer-to-peer events, there'll be place-based events, there'll be masterclasses and training, and we will also at the beginning have these one-to-one and group sessions as well, so that you can all get the opportunity to ask for what you need. So the easiest way to access that is by scanning the QR code that's on the screen now, if you do have a phone with you. I'm aware some of you might be watching on your phone, so you may not be able to do that, or that may not be accessible to you. So we will, when we send out the recording of the meeting, we will also send out links for you to register and do that. And it will just take you to a short form which will show us where you are and what the main areas of help that you need. Okay, so we're going to move on now. I know that was a like very quick brush, but just being mindful of time, we wanted to, when we were planning this event, we wanted to give you as much time as possible for questions and answers. And so what we're going to do now is we're going to, Becky, Ellie, and myself will be off mute, and it will just be the opportunity for you to ask any questions about each of our roles. So we'll go through in the same order as the presentation. So we'll start with Becky and the Access Wellbeing service and your connection with them. So all I'd ask you to do is to just use the raise the hand function if you can, and we will just call out who we can see the hands raised. So bear with us while we get that set up, and yeah, just take a moment to think about your questions and what you need to know to progress. Thank you.
I have picked up one of the questions in the chat, just so people are aware. I think it was Mark was asking about donations from participants, so I'll make sure that I cover that one.
Brilliant, thank you. Okay, so
Hi Sharon, is that a question for me?
Yep. Hi, can you hear me okay?
I can.
Oh, right. Yeah, no, my question was actually for Ellie, so I might have jumped the gun.
we're going to start with questions for access to wellbeing, but Sharon, we'll keep you as the first one for Ellie.
I love the keenness. This is good.
I know. I'm just being an eager beaver. I'll put myself back on mute.
And you may not have questions for all of us, and that is absolutely fine as well. You know, we've kind of given you a lot of information, and it takes time to process and work out what you need to know. So please don't think this is your only opportunity. You can reach out to us after this event as well. So I'm seeing a hand. Dorset Menopause Support, would you like to ask your question? Thank you.
Hi, Becky. It's just a really quick one. Currently, at the moment, we have in-person groups across the north of Dorset, and we have sort of liaised with the Access Wellbeing teams in the north. But we're very keen, and we've just about to want to launch more groups in the south and other areas of Dorset, which is why we really hope we can work with this fund to do that. But would it be, if we want to set up new groups and go elsewhere, would it be a good idea to sort of try and go and meet the Access Wellbeing teams in those areas? Or is it enough that we've already connected with quite a few people in the north, and generally I think they do know about us and have referred someone in to us already?
I think it sounds fabulous, first of all. So I didn't catch your name.
It's Rowan.
Hi, Rowan. So yeah, it sounds fabulous, first of all, is what I'd say, and definitely a need. I would say that we could think about getting you along to one of the partnership meetings so you could meet the hub managers. We could think about different ways in which you engage more broadly. If you wanted to come and meet or come in person to any of the hubs, we could arrange that. But I certainly think the conversation bit is important because that helps with the engagement. So yeah, I would say it's great that you've got a relationship, I assume, with Nick and or David in the north. But it would be great to meet you and understand what the offer is and think about how we can link it in and make it accessible across the whole of Dorset. Yeah, that would be great.
I think I've met some of the Weymouth team at a different training event, and and they have some of our leaflets and things. So obviously being in the north, is obviously time with travel is always a barrier, but I'd love to connect more with them because I think it's already proven very valuable to connect with the Access Wellbeing and other mental health organisations in the north and through Dorset. I mean, Dorset Mind we already have a connection with.
Yeah, absolutely. I'd say the same to you and to everybody else. You know, we're more than happy to meet online. We'll make it as accessible as we can because the more we learn, the more we can connect and support those people in the community. So by all means, reach out and we can arrange that.
So do I get in touch with you?
I'll pop my email in the chat so that you all have it.
Okay, thank you.
I think we've got a question there from Men It's Okay.
Can you hear me?
Can?
Hello. Oh, hi. Good afternoon, everyone. My name is Prince Obuji. I'm from Men It's Okay. We're men's mental health charity. First, I want to say a big thank you to Tama for inviting me for the meeting and for all the support she's given us so far. What I wanted to ask you was our impact areas. We've been going for about 5 years, but unfortunately, we haven't been able to. We haven't even applied for or gotten any funding. However, our impact areas have been within Hampshire and Dorset. One, because I had a lived-in experience of mental health breakdown after I lost my business in Southampton. Now, my question is, how does that affect our funding? Because a lot of activities, like I said, are cut across Dorset and Hampshire. We've got a lot. I live in Bournemouth myself, which is Dorset, but I also do have people coming from Southampton for our events when we do hangouts or we do any sort of seminars to improve men's mental health.
I think that one's for me. So I'll quickly say, yeah, you're not the only organisation that has participants that come from another county. So that's quite usual. We are a Dorset funder and the money's from Dorset NHS. So as you can imagine, the money that we give you does need to be ring fenced to your Dorset residents. So what you can do is put in a proportional application. So for example, if about 50% of your participants are from Dorset and 50% are from elsewhere, then just apply for 50% contribution towards your costs. And then we can feel that the grant has been ring fenced to your Dorset participants. Does that make sense?
Of course it does, yeah.
Perfect.
It does. Thank you.
Just a quick question, if I may. Dorset includes Bournemouth, Christchurch, and Poole.
Yes,
Yeah.
we're talking County of Dorset. Yeah.
Yeah. Thanks.
I can see Michelle Fuller's waving at us. Michelle, take yourself off mute. What's the question?
Hi, I'm from Becky. Sorry, I'm very, very new at this. So this is the first actually online training course I've sat through. So, and forgive my ignorance. I'm volunteering with Allendale Community Centre. We're based in Wimborne, and it's probably my lack of knowledge, but I do know that we employ and have volunteers. Predominantly, everybody I've come across has mental health issues, and some of them are severe mental health issues, or they're ex-school leavers that have had or suffer from ADHD. And they do have their own carers, and they have people that look after them, and we have safeguarding meetings for them. How would they be, or would having more people like that join us that we'd have to support, but they have their own care structure? Would that something that Access Wellbeing would then want to be involved in, could be involved in, or is that outside of the remit?
No, absolutely. It's something that we could be involved in. My colleague Josh supports the offer over that covers your area. I'm just looking for the drop in on the website that there's one in Ferndown. There's definitely one in Wimborne. I'm just trying to find it at the moment. But anyway, I think the point is, absolutely, if you drop me an email, I've put my email address in the chat there.
Yeah.
I'm more than happy to introduce you to Josh.
Brilliant. So that would be a link in, because what we wouldn't want to do is duplicate sort of the carers. I'm not their carers and their responsibilities. So if they, yeah, I'll talk to Josh. That's the best thing. Thank you.
Thank you,
Right.
Michelle.
Thank you.
Shall we go on to Sharon next? I think she's been waiting patiently.
Yay, here I am. Yeah, it was just a quick question, Ellie. You'd mentioned about the continuation funding. So people funded in 2024. Was that just for the larger grants that were awarded at that time?
No, it was some of each. We put together an advisory group that looked very similar to our decision panel, and they went through all of the end of grant report forms that we'd received from the groups and kind of made a selection across the geography, across thematically who we're supporting, and obviously looking for projects that they felt really demonstrated a high demand and a need to continue. As ever, we had a target. We couldn't invite that opportunity for everybody, but no, it was across the smaller grants as well.
Yeah, no, that's fine. Understand. Thank you very much.
Should I answer the question in the chat before I completely forget?
Yes, yeah.
That'd be a good
and then
idea.
We'll go on to Twilla. I think she's been waiting a while. They've been waiting a while.
So the question was whether it's acceptable to invite your participants to contribute to your service financially. Yes, absolutely. Like all community groups, you will need to have a diverse range of income streams that support your sustainability. Just applying for grants is not sustainable income. So you need to find other methods. So if unless you're working with people who are all in poverty, in which case it perhaps isn't appropriate, then yeah, asking for people to contribute towards the cost of the service that's benefiting them is okay. Obviously, we have to be mindful that not everybody will be able to afford to pay the same amount. It can be quite tricky finding a model that works for you and that is respectful of people who cannot contribute, and that's the difficulty. So there's lots of different very clever models that I see when I'm out visiting groups of how people invite contributions but don't that don't make people who can't afford to pay feel bad about that, essentially. So again, talk to CAN, they'll be aware of these different models that exist, and they might be able to suggest what might be a good way for you to do it, or even get you talking to another group who does it really well. But yeah, absolutely, that's a positive if you're doing that, as long as you're doing it well and you're doing it in a respectful way.
Thank you. Can we go to Twilla next?
Hello, thank you. Can you hear me?
Yes, yeah.
Right, thank you. Thank you so much for today. It's been so good to get all this information. Ellie, you mentioned about when we write applications, the religious aspect. So I'm just thinking, because Women of Purpose, first of all, started as a Bible study group, and then we've obviously expanded into looking out for the mental well-being of specific women from an African background and that kind of stuff. So, and there is a thing about some cultures and certain groups of people, and certainly the women that we're working with, where religion is their kind of way of mental health well-being and coping. So how do we balance that when it comes to actually making the application, where we separate the two, if that makes sense? And that's if I understood you correctly. How do we balance the two, and would we be quote unquote in trouble with the funders where the women are taking part in the religious activities? Because I feel like I'm waffling, but we had a tester session and most of the women were saying, oh, it would be nice to have like a worship night. So while I appreciate maybe NHS wouldn't be funding the worship night, but that's one of the things that they suggested, other than going for walks and having fitness classes, that they want to do to overcome loneliness and stuff like that. So how would I separate that for our CIC on the application? Thank you.
Yeah, it is a really tricky one around this. I think again, it goes back to not changing who you are because of a funder. So actually, if the women you're supporting, it's really important for them that they are practicing their religion as well as receiving support. It might just be that this isn't the right fund for you, and you need to look at other ways to raise income, or funders that are happy with religious activity, and there are some that are okay with that. It kind of depends what you're doing. So if you feel that it's really clear that some women come on a Tuesday to have a religious experience and then other people come on a Thursday to have a non-religious experience, and you think it's really well defined, then you could apply obviously for the community service that's not linked. But I think panels can be a bit wary of, if the same people are coming to both, how are you giving that message to the community that actually that Thursday you don't need to be a member of our congregation, you don't need to be a member of our religion, and if it feels too exclusive, it can be difficult for the panel to fund it. So I think it's probably just thinking through, you know, how you deliver, and if in all honesty it is a service for people of a particular religion, you know, there's nothing wrong with that. I'm sure that's really valuable to the people you're supporting, but it may be that grant funding isn't the right, you know, way for you to raise income. Or as I say, if you feel it's really well defined and it's really well promoted to people outside your religious community, then by all means apply. Just do the best you can to make a strong case that it is genuinely community focused and for everybody, and that the people feel welcome.
Yeah, I think the latter applies to us anyway, because there's different activities and they're not obliged to attend the worship nights if they're not of a Christian background. But it's just, I just need it. But yeah, that helps. That clarifies that. Thank you so much.
Yeah, no worries.
Sharon, would you like to unmute? Who's your question for? Or is your hand still left up?
Oh, sorry. Yes. I was...
No problem.
She's not that keen.
Rowan,
both hands going. No, I have no further questions at this time.
Okay, wonderful. Rowan, did you have a question?
Yeah, just quickly, I am getting the distinct impression that this fund is, and I know I've asked Ellie this before, but I just wanted to really clarify, this fund really looks like it's there to support groups and peer support groups in the community rather than one-to-one support.
In the main,
am I
no,
yeah.
I think you're right. I think because, and especially with my experience now with the previous rounds, you know, they have been really keen to see that often community connection is a big part of resilience.
Yeah.
If you've got nobody around you to support you in your next crisis, you're likely to fall over again. So the majority of the grants were for working in groups, but we did make a small number of grants, and I can think of examples where actually the support was one-to-one or in really small group settings, because that was the most appropriate thing for those particular individuals. But what those services were tending to do was give a period of support on a one-to-one basis. And then again, it's about saying, right, if we're coming towards, you know, the end of how we can help you, how are we going to help signpost you into other services?
Yeah.
And where that was done really well and in a specific way, not just a general, oh, and we'll tell them what else is available. You know, if it's done in a structured way, or even that you're introducing participants, you know, potentially yourself. So you don't, it doesn't have to be group work, but I think they just want to see that long-term resilience. And if you can argue that one-to-one advice and support is genuinely helping somebody to become more resilient, that's a strong case you need to make. But yeah, I think
it's hard because we do both, and actually a lot of women come initially to have a one-to-one because they don't feel emotionally stable enough or strong enough or resilient enough to actually go into a group setting straight away. It's just too overwhelming. And so we sometimes, not always, but we sometimes do one-to-ones and then they go to the group, or they do another group activity that we offer.
So
and
that's
then
great.
they
So
build
you're
their
designing
community
your
from
offer.
there.
Yeah, so you're designing your offer in responding to the needs of your participants. So, you know, just make sure that comes across. We're doing one-to-one for these reasons, because that's the way that people want to engage and they feel comfortable engaging. But if your service, you know, is then providing a range of different kind of journeys, if you like, and actually, you know, I think that's fine.
It's hard. I just don't want
we
to
did more groups
complicate.
than one-to-one, but again, you can't change who you are for the funder. You've got to do what's
No.
best for your beneficiaries. So apply, make a strong case about long-term
Yeah.
resilience, and see what happens.
I just don't want to make it a more complicated process for myself than it already is.
No, don't. And
So,
don't invent new things because you think it's what the funder wants to hear, because
no.
it's just not sustainable, and it just causes mission drift. So if you apply and you're not successful, I hopefully could signpost you into a more appropriate program. But I do think it's worth you applying, because I think you've got a
Yeah.
case there that one-to-one is the right type of support. And if people are more resilient and have those coping strategies as a result,
I mean,
then
as we want to get more groups set up around Dorset, maybe it's better we focus on that for this particular fund, and sort of, you know, work with the Access Wellbeing and the referrers that we already have, because that actually is a really good way to get the information that we provide as well out into the community to those women. Just another really quick question. Obviously you listed a few things that you provided the funding for. Does that include the resources for the groups, such as, you know, we provide booklets that we hand out? Would it cover the cost for those? And sort of we've managed to recruit a lot of volunteers this year ready to set up some new groups. Would it cover sort of clothing for them and, you know, volunteer expenses, as in travelling expenses?
Yeah, absolutely. Yeah, volunteer expenses. Yeah, again, with booklets and things, you know, again, just make sure that somewhere in the application you've told us why that's important, even if it's a smaller part of your budget. We need to understand the value of that so that the panel can make a decision about funding it. Do you mean sort of branded clothing for volunteers?
Yes. Yeah.
Maybe. I think when funding is tight, I think, you know, that's a bit of a nice to have, as opposed to this is how we get people to get better in their well-being. You could put it in if it's a low cost and see what happens. Again, make a case as to why it's going to enhance your service. But I think particularly with NHS, they want to fund the work. They want to fund the work. Yeah, and the costs associated with that work.
And what about advertising costs, such as, I don't know, pavement signs and things like that?
Yeah, potentially. Again, it comes back to how are you going to reach your community? So if for you it's not about direct signposting or referral routes, or, you know, if it is about advertising and promotion and awareness raising, then it would make sense to support you to enhance that promotion. So yeah, don't see why not.
Okay, thank you.
Thank you. Jane Atkinson.
Well, thank you very much. As may be obvious, I'm not Jane. My name's Martin. And it's nice to put a face to the name, Ellie. I don't think we've actually seen each other previously. I've been doing the funding applications for Positive Path Foundation for 7 years now.
Oh, nice to meet you.
So nice to meet you too. We have around 25% of our. We're actually based in the New Forest. That's the first thing I have to say. The office here, but roughly 25% of our members are based in BCP, not in General Dorset, but BCP specifically. Our furthest member is Paul. We get referrals from NHS social prescribers in Dorset. We work with Dorset CAMS and with schools and colleges in Dorset, as well as obviously Hampshire as well, and New Forest. I'm assuming that the previous question that you answered, we would be eligible to apply for proportionate support for our members that we serve in the BCP region. That's the first
exactly
question.
Yeah, hopefully you've got you take enough kind of registration details of people that you work with, so you've got a rough idea with postcodes or anything. So if you can make a reasonable estimate as to the proportion, you know, in the coming year that are likely to be from the Dorset area, then just make a proportional application. It's important that I'm always transparent, that so organisations that we would classify as regional, if you're working in more than one county, you would usually be a lower priority. But it's not to say you wouldn't be funded, and it is still worth applying. But just make it proportional, and, you know, tell the panel how you know that 50% are from Dorset or whatever.
Yeah, it's 25%,
Yeah.
which we know. But so
It's
here's
re
the thing. Yeah, we received a small grant, a health and wellbeing grant in 24, I think.
yes.
I weren't invited to continue it, but our work continues. Um, I would like to make contact with the head of the Boscombe Access Wellbeing Hub, which I think is probably the one that's most appropriate for us. And so is that something that we have to do through CAN? Is it in the deck? Will we get a copy of the deck that was presented here?
Yes,
Sorry, a
yeah.
lot of questions, but
That's okay. You will get a copy of the slides, so you'll have the details on there. But also, Becky just had to leave, but she did leave her email in the chat. So if you lift that and email Becky directly, she'll give you the appropriate contact and put you together.
got it.
Brilliant.
Absolutely,
Okay.
absolutely perfect.
So
Thank you.
just in the interest of time, we've got about 13 minutes left and we've got 3 people with their hands up. So if we could move, we're going to move on if that's okay, Martin.
Sure.
And
Thank you.
just a couple of minutes really each for the next questions. But then, you know, you are able to come back to each of us if there's anything pressing that we haven't answered. Maria, would you like to go next? Unfortunately, I can't unmute you.
You can always type it in the chat, Maria, if you're having issues with your mic.
Okay, we'll move on to Mark and then we'll come back to you, Maria, if you can get off mute or pop your question in the chat and Ellie can pick it up from there. Mark.
Hiya. Yeah, thank you guys for everything you've been doing today. We're a counselling charity in the New Forest and also parts of Dorset. I appreciate that it's got to be non-clinical, but some things have come up in the last year that I'm really passionate about. We work in churches, so we actually use churches to provide us with a room or the space to actually see people. Would that be an issue that we're actually working out of churches, or will we need to
No, it's really common. So that
Yeah.
you know, just because your venue is a church, we wouldn't somehow presume that you're then saying a prayer in front of every session.
Yeah.
No, that's fine. I mean, some people would say they don't feel comfortable going into a church building, so I guess you just need to be aware of that. Sometimes other types of community spaces can be more inclusive, but if that's the best place that's local to you, we wouldn't judge that.
Yeah, I mean, loads of stuff goes on in churches. There's loads of different events and community things. The other thing that's come to mind for me was working in the area of porn addiction, and I'm just wondering how that would be viewed, because I know
working with people in recovery from addictions. Yeah, absolutely. We did award a few grants to that cohort last time. Again, that is a group of people that are more likely to experience health inequality. So actually, that sort of application for that sort of focused work would be really welcome. Yeah.
Okay.
But
and
not counselling, as you've said.
Like with referrals and that, would you, because there's a few organisations that they can move on to get help, is things like Naked Truth Project, although they are kind of foundational on a Christian faith, they don't push that in their click to kick work that they do with guys. So it is secular.
Brilliant.
So would that would be okay to refer guys onto that, wouldn't it?
Yeah, I mean, it's about the work we're funding. So if actually you choose to refer someone you know is Christian to a Christian organisation, that's not for us to be judging that. It's about the work we're funding and make sure we're not funding anything that's influencing people's religious choices.
Brilliant, thank you.
But you're right in terms of the counselling. So if you're doing I think I saw in the chat you were talking about reflexology and other types of services.
That was someone else, I think.
Was that someone else? I presumed it was the same. But yeah, you're absolutely right. Don't apply for your counselling service because it will just not be funded. But if you've got additional work you do that complements your counselling, that's what to go for.
Okay, thank you.
Brilliant. Marie has put a question in the chat. And so if she was awarded a grant in the last round but hasn't been invited to apply this time around, are they still able to apply? And if so, would it need to be for a different project?
Yes, absolutely apply. It always causes me great sadness that I can't just fund everything. There's usually a very small number that are ineligible or not appropriate, and I want to fund everything else, but we just don't have enough funds. So yeah, I'm sorry that we couldn't invite all of the groups who were funded last time to apply for continuation, but then we would have had no opportunity to fund any other work, which didn't feel right. So yeah, I'm sorry if that wasn't you, but absolutely you can apply for the same work if it's continuing, if you're in demand and you need to continue that work for the good of your community. Essentially put in an application for continuation funding. If you are doing something different or something that's expanded or changed in some way, that's fine too. It's just on the basis of yeah, whether it's an appropriate service and whether you're making a difference. So yeah, please do apply. Don't feel like you will be on a back foot in any way. Your application will be looked at, the strength of your application compared to the other applicants in this open call round.
Brilliant. And then I think we've got Mark. I'm not sure whether your hand's left up or whether you've got another question, and then Kate. Oh yeah, okay. So Kate, please, if you'd like to unmute.
Yes, hi, it's Kate from Axminster and Lyme Cancer Support.
Oh, hi.
Hi. That question was from me about counselling. Obviously, counselling isn't qualifying. However, you know, what is considered as non-clinical are reflexology, acupuncture, massage, scar release therapies. Would those count, or is there a definitive list of what does and what doesn't count?
No, I don't have a definitive list, and that's an interesting one, acupuncture, because that can be offered under the NHS, although I think it's normally for physical health conditions where the NHS would offer acupuncture, is my understanding as a layman. Whereas if you're providing acupuncture in terms of a wellbeing mental health outcome, that might be different. I think I need to check that actually. Kate, would you email me a list of the different services you were hoping to include in your application, and I will check that with our NHS contact who sits on the panel. I don't want you applying for something that they're just going to reject, so I think we need to check. Yeah,
that's really helpful, thank you.
Yeah, it's just reflexology you think would be fine, but yeah, acupuncture, yeah, I need to check that one.
Yeah, we do auricular acupuncture, which is shown to be really good for anxiety and has really helped clients, but obviously we don't want to include it if it's not eligible.
Yeah, absolutely. Yeah, no, we'll make sure. So if you send me an email, I'll get on top of that straight away.
Thank you.
Ellie, just a very quick question. Is there the standard, it's Anna from Africa Caribbean Launch Club. Is there the standard monitoring form that we filled out for the EDC at the end of the...
It will feel very similar, yeah. So in terms of monitoring requirements, it is just one report at the end of the year. So if you had a 2-year grant, you'd have to do one at the end of year 1, and your next payment would be conditional on that, and then again one at the end of year 2. But yeah, it will feel very similar. So it will ask you about what you've learned during the period, what you did, what the outcomes from your beneficiaries were. And we always ask for one story of change. So a story about a particular individual that you supported and what happened for them, which of course you can anonymise. There is also for this fund, the thing that's different to EDC actually, for this particular fund, in terms of monitoring the outcomes of your work, because we're trying to make this evidential case to the NHS that they should be investing more in our sector, it's a bit more structured. So you'll find in the application form, we've got a long list of the different things that you might be measuring during your project. So it might be that you ask people do they feel less lonely, or do they feel more connected to their community, or put me on the spot now and I can't think of one. But there's a list of different things that you might be measuring in terms of evidencing those outcomes, and we ask you to just select the ones that are appropriate for you and the ones that you're going to measure. I think we ask you to select 4, so it's not a huge burden, but so you'll have to kind of select those ones that you're going to be measuring, and then in the end of grant form, obviously we'll be asking you how many people did achieve those 4 things that you said you would measure. So it's just, again, comes back to making sure that you know how you're going to measure those, and that you've got a plan in place, which will help you with if you're not sure.
Great, thanks.
Fantastic. Okay, so I think we're really close to the end of the session, and I just want to remind you all to look in your inboxes. We will be sending the recording out along with the slides, and we'll also send you that QR code and a link so that you can book in a session to meet with, some of the team from CAN. And also, if you have any further questions that didn't get answered today, or you think about later when you get home, that's usually the case for me, do please email me and I will pass those on to Ellie and Becky. So thank you so much for your time. We realise it's a lot of information, but we wanted to make it as valuable as possible. So hopefully you have everything that you need to make a decision about whether it's the right fund for you and to know what your next steps are. Ellie, is there anything that you wanted to add before we close down?
Only to say, my request is if you need support with your application, if you're not sure if your project's the right fit or you don't have one of those documents, on this occasion, please contact CAN. So ordinarily I take most of these calls, but it's really helpful for me on a very high demand programme that we're in partnership with CAN. So please ask all those questions to CAN. If they feel that you need to ask me something direct, they'll let you know. But if you have a problem with the system, so with the application form itself, or you can't log into our portal or anything like that, I am still on the end of the phone. I don't mind those individual conversations, especially if it's to do with the physical, how you apply to us. So I am still here, but CAN are your best friend and will have more time and capacity to help you than I would. So that's why we're working in partnership. So big thanks to CAN for doing that for us.
You're very welcome. You're very welcome. And just so that you know the team, Tama, who's been here managing this chat for us, big thanks to her. It's her tech skills that has answered everybody's questions and make sure that you're all admitted okay. We also have Brian here, Brian Reeves, and we also have Katia here. So, when you do work with us, we're familiar faces. You probably know one of us already. But if you don't, we look forward to getting to know you and supporting your organisation. So thank you very much, everybody.